So without further ado, I will turn it over to Sherry.
Hello, everybody. I'm going to share my screen and let's make sure I can. Okay. I am actually not Erika Chapman. That is my boss. She's our program manager for the harm reduction program here at the State Department of Health. And if I am the harm reduction program coordinator. Here is our mission at the Department of Health and our vision for how we want to reach all Hoosiers. And just as a part of our harm reduction program, this is something that we encourage and share, a trigger in self-care. We're going to talk about substance use disorder. We're going to talk about harm reduction, and we like to include a trigger warning so that if for any reason you feel like you need a break, you need to like turn off the sound, mute me, please do so, because harm reduction is self-care and self-care is harm reduction. So we want to make sure everybody's taking care of themselves. Okay, for a quick overview, we're going to talk about what substance use disorder is, what harm reduction is, what harm reduction programs in Indiana look like, and how you can become a harm reductionist. You probably already are and you don't even realize it. And then we're going to save time for questions and answers, but feel free, don't save your question until the end. Put it in the chat, the Q&A, so you don't forget what it is you asked, especially if it's about a specific slide or something. Erika put this together. I've done this presentation mostly before, so there's some things that I might not read. I'm not going to read it word for word, but if there's something you want me to go into more detail or have a specific question, please do it. And then of course, I'm going to leave you with the contact information for Erika and I to further the conversation for you and your organization and counties. Okay, the structural impact of substance use on substance use. There are lots of reasons why someone has a substance use disorder problem. The first and foremost is we're going to tell you that it's not someone woke up today and said, I'm going to use drugs. That is not the issue here. The issue is things are going on in their life, unemployment, experiencing homelessness. There's sexism, racism, homophobia, transphobia, marginalization, all these things that are going on in our world. The heaviness of politics, the life circumstances. We talk about party lifestyles. You tried it once, but then it became a problem. Boredom. Some people, that could be a reason. Trying to get rid of physical pain or behavioral pain. Mental health is a huge barrier for or huge interaction that causes a lot of people to try and get balance in their life. So they use substances to do that. Helps you forget, helps you feel better. And obviously people use substances to get past trauma or violence in their life. Integral use or intergenerational use, sorry, I'm reading too fast. As this quote says, I was given a shot for my 13th birthday. One of the things that we see a lot in Indiana and in general is that sometimes you're introduced to substances from a family member. It may be a cousin, it may be your parent. Maybe you saw them do something and then you try it because they look like they're having a good time, so I'm going to try it and have a good time. Or the trauma in your family goes through multiple generations, and that's why you have tried it. Substance use disorder or opioid use disorder is generally defined as the use of any substances leading to health issues and or impairment in the function at home, social, or school or work. It is a disorder. There's not a single case of SUD. However, genetics, environmental, and conditions, there's not a single cause. Sorry, that's an important word in there. There's
Sherry,
not a single.
I'm sorry, we're not seeing your slides.
Oh, you're not. That's not good.
No.
Oh, okay. Let's see. Maybe, oh, guess what? The shared screen didn't click. I must have missed a button. So sorry. Okay.
Now we can see them.
Okay. All right. We'll start here. Is this good? Because we were talking about the substance
Yes,
use disorder.
perfect.
Okay. There's not a single cause for substance use disorder, but there are several things that can affect it. Genetics, environmental conditions, other mental health issues. Substance use disorder is a disease and it alters the brain. There is no moral failing. There's no character flaw in a person that has it. I like to use the example of when I was a child, I could take baby aspirin, baby Tylenol. And then as a teenager and adult, my parent would give me one Tylenol or an extra strength Tylenol maybe. But as a grown adult of 50 years old, I can tell you that it takes 4 extra strength Tylenols to get rid of a good headache. A Tylenol is not addictive, but my body cannot process Tylenol the way it did before to get rid of pain. So it's the same thing with substances. Someone tried something, it helped for this minute, but then later they had to try more of it because it's the only way to get rid of the pain. But it's their body is the way your chemicals reacting to an opioid is the way you how substance use disorder attaches to itself. There's several treatment options available. They're not, there's so many options. Like there's no one-step way to get into recovery. And this here lists several different types: talk therapy, individual or group, 12 steps or other peer recoveries, medicated assisted therapy. The amazing thing about the recovery world is there is a path for every person. It's just a matter of finding what that path looks like for you. Not everybody is going to recover the same way, even in the same family. And there's so many different types of recovery. We have some amazing recovery groups in Indiana. We're very fortunate to have. So no matter what, we can always find a pathway that's going to help someone. Substance use. This is blocking my slides a little bit, so it's hard to read the title, but oops, I went too far. I'm so sorry. I'm not used to doing this part, the clicking by myself. So one of the things with substance use disorder and why it's so tied to harm reduction is we're trying to stop the spread of infections, bloodborne diseases, HIV, Hep C, Hep B, and other infections that are caused by sharing items such as needles or cookers or cottons, different items that are used when you're injection and drug use. Those all could hold blood on them items, and then those could help transmit it. If I'm using a needle and I share it with my, my friend, whatever, infectious diseases I may have, and whether I know it or not, could be shared. And that's something that's where harm reduction ties into, teaching about not sharing those items teaches us to, lessen the harm of the things that we're doing. Okay, what is harm reduction? So this is where it all ties together. Harm reduction is a public health prevention strategy. It's aimed at decreasing the risk of some potentially dangerous habits. I like to say if you're going to do something bad, do it in a less bad way. And the foundation of all harm reduction efforts is to meet the person where they are. Not everybody's ready for recovery. Not everybody is ready for treatment, but they are ready to, be better for themselves. One of the things that I think is amazing about people that use substance, they are very quick to latch on to a way of doing something that's going to be less harmful to themselves. And any positive change in behavior is harm reduction. We brush our teeth every day because we know that that's going to help our teeth and help our gums and help our health. That's harm reduction. If we forget, we know what it feels like in our mouth, and we know that we're creating extra bacteria. We're going to get a cavity. It's the same for people that use substances. If they're met where they are, if they're brought sterile supplies, if they have access to sterile supplies and new supplies, they're less likely to share. They're less likely to reuse those items and cause themselves more harm. Common of examples of harm reduction, we have a great list right there. We use this a lot. We talk about wearing a seatbelt. You may not need a seatbelt. 10 times in a row, you are fine. But that 11th time you don't wear your seatbelt, that's when you have a car accident. You never know when, reusing that syringe is going to be the time that it's going to cause you to get Hep C or another bloodborne infection. Social distancing, wearing a mask, all these things we learned during COVID about not spreading, germs, and washing our hands and all these things, establishing a designated driver, wearing sunscreen, um, syringe service programs, PrEP, and using condom during penetrative sex. All these things are harm reduction. You're lowering your risk for getting hurt, whether it's physically through a sexually transmitted disease, any of the sunburn, whatever you can tie harm reduction to any aspect of your life. And then we just tie it in a broader terms to substance use disorder by meeting them where they are and trying to reduce their risks. Harm reduction outcomes, the primary goal is to harm reduction activities is specific to substance use disorder is to prevent the transmission of HIV, Hep C, and Hep B, and other bloodborne infections. That's how we've got syringe service programs in Indiana. And that's how we are, we market our, I don't want to say market because it's not like a buyable goods, but that's how we talk about our program in the state is we want this to be something that helps reduce those infections and help eliminate HIV and Hep C in the state of Indiana. Secondary outcomes include and are not limited to these items here. By having a place for people with substance use disorder come to get supplies and care, it's an entry point for many services and referrals. When you have that one-on-one connection that you meet, whether it's at a health department or an agency, there's someone there that's going to acknowledge their use, but not not stigmatize them over it. They're going to give them the services that they need there, but they're going to offer referrals to, housing, insurance, food, possibly clothing, possibly. There's going to be a wraparound care. The syringe service programs, and in Indiana, we specifically call them service programs because there's more services there than there are just coming in to exchange a used needle for a new needle. The overdose prevention, over amping prevention, and support education. Having these programs helps reduce overdose deaths because they have access to Narcan, they have access to education, they have access to human connection. A lot of times people that have substance use disorder feel alienated and they need that human connection to bring more value to themselves, to remind themselves that they're important and that they're needed. And obviously it helps and reduce endocarditis. That's a hard word to say. And reduce needle stick injuries to first responders. If someone's going to an SSP, they're properly disposing of their syringes, they're less likely to have them in their pockets. They're less likely to have them on themselves when, and coming in contact with first responders, whether it's police officers or EMTs, paramedics. Through our program, we offer supplies for no charge. It's like a non-funded program. We connect with local health departments and our non-syringe harm reduction partnership, and we offer you the supplies at no cost for a little bit of reporting data. There's 4 meetings a year, the kind of thing that we meet up. We might email or connect, more often, monthly, I'm literally here to help people build a program, whether it's from the start or if you're partnering with somebody else. But these are some of the supplies that we offer and pass out. I'm sure there might be some questions about what some of these products or items are specifically, and I'm happy to go through them. But this one here on this side here is the injection drug use kit. So you'll see like cookers and cottons and water specifically to, this helps with single use injecting. And then this kit on the other side is our smoking slash snorting kit. And then there's like pipe covers for to help protect the mouth from burns and or dry lips. There's lip balm, because any place that you can have blood, a cracked lip, a sore on your mouth, a sore inside your mouth, an injection site, any of those places that can get infected could possibly transmit HIV or Hep C. And so we give all these. And we would be remiss with not having condom and lubes in all kits because that's prevention 101. Here is a little closer look at what a cooker is. In case you're not familiar with that term, this is basically a small little aluminum type disc. Some places you might see in a movie or something where they might use an aluminum Coke can or some kind of glass, but you basically you're cooking down, you're taking water and you're putting the drug in there and you're melting it down so that it can go into a syringe and inject. The reason why we pass out cotton is because the drug itself, although naked to the eye, you won't see it, could still have particles in it that didn't completely melt down. So using the cotton as a filter will help alleviate particles going into your arm and in your veins and causing other injuries to yourself. We offer sharps containers of several different sizes so that individuals can use them, return them to a proper place, and or even with these, they're clearly marked biohazard. Even if they got thrown in regular trash, sanitation departments recognize them, they know what they are, and they can properly dispose of them on their own. Bleach is something that we use and share and educate people on because there is a way that you can use a rinse it's a 3-3-3 rinsing out with water with bleach and then water again 3 times over and over. You can sterilize a syringe again. The only problem with it is it's still a used syringe, so the tip of the syringe is not as sharp, so it could still cause injuries or scrapes on your skin because it's bent a little, even though you can't see it to the naked eye. But it would be sterile of any bloodborne infections or blood that's in the in the barrel or in the main part of the syringe because you're using the bleach. We recommend using single-use tourniquets and pipe covers and straws. Again, all these items are something that could come into contact with blood, whether it's from chapped lips, whether it's from the nasal cavity, or because you're injecting and blood was able to get on the tourniquet. Harm reduction in practice. Harm reduction programs, including SSPs, typically provide the following items. They will provide new sterile substance use supplies. They will supply wound care items. They'll supply hygiene and personal care items. Some of these items are part of our program and we offer them for free. Some of them, that's part of the partnership building that we recommend in your community, and you can help collect these hygiene and personal care items from local groups that would help build the program that you might be building. If it's a health department, most of them do offer testing for Hep B, C, HIV, STDs, and TB. Not all of them have it. It depends on the size of the health department or if they have access to a clinic. But we do strongly encourage referrals. Making sure where you can get all these testings done is an important referral to have. Harm reduction in practice is talking about and sharing information about immunizations, and then referrals to substance use disorder treatment, mental health and physical health care, housing, clothing, insurance, navigation, and other wraparound services. Again, reiterating that this is a wraparound care. No one comes in with the idea that they're just there for those items and then they're going to leave. Someone's going to ask them how they're doing. How are you feeling? Is everything going okay with you today? Did you eat? Did you have something to drink? We've got some sweatshirts, we got some socks and that kind of stuff. They're going to be checking in on their whole well-being, not just supplying them with the new substance use supplies. Participating in harm reduction program varies. It depends on what you as a person feels ready to do and what you as a community have created to and what's available. But people could visit a harm reduction program or syringe service program. I highly encourage it. You don't know what you don't know. A lot of people think it's some big, scary place. Most of these places are painted colorfully. They're shiny. There's lots of light. There's lots of smiles, lots of hugs. Um, we're talking about people that feel alienated from their families and their friends and probably their coworkers. They keep to themselves. Some of them may be experiencing houselessness, so they don't really have a comfortable place to go. And so this might be the warm spot of their day, getting out of the weather. So people may visit, you can go and if you're a diabetic, if you're taking hormones or allergy shots, anything like that, we strongly encourage you to use the SSP. It breaks down the stigma that the syringe service programs are only for people that use substances. We would like anybody to return their syringes there, the less syringes that are potentially in the trash or on the street and getting reused incorrectly. All SSPs have a way of collecting the used sharps. Our local non-syringe harm reduction programs throughout the state, it'll vary. If they have a clinic, if they are already doing immunizations, they most likely have a way of collecting them. If it's an agency, they sometimes have a contract, sometimes they have a partnership. It just depends. And that's something that I'm happy to talk more about and help people with talking or like how to make that work for them. You can learn about the signs and the symptoms of an overdose and overamping, and you can learn how to reverse those with using naloxone or rescue breathing. That's one of the things that we like to talk about a lot is the naloxone will work, but because it only lasts for so long, there is still potential of a re-overdose depending on how strong the drug was that was in the person's body. So making sure you're there, you stay with them to rescue breathe for them or to be able to administer another dose and getting them help as they need it. If you're a service company or if you have services that would be important to a person that has substance use disorder, you can help with access referrals and testing. And you can volunteer and donate supplies. Volunteer your time just to be there as a greeter, to be there to depending on the program, there's lots of different things that they do. We have several sites that like to, while they're hosting hours for the SSP, they also do a community cleanup at the same time. So if you wanted to be a part of that, it's kind of like giving back to the community as they're doing the hours. But donating supplies, we're always encouraging them to find personal care items, toothbrushes, toothpaste, period products, clothing, shoes, gloves, coats for the winter, sunblock in the summertime, cases of water. They don't know, hospital or health departments don't always have the extra funds just to have cases of water sitting around. So if you personally can donate that to your local health department to go out to people, that would be awesome. Harm reduction is on a service continuum. And this is what it looks like: community cleanups and sharps disposal boxes and drug take back events. A lot of these things are already happening in communities. So that's on one end. Then you've got your non-syringe harm reduction supply program that we use with the local health departments, your SSPs. And then at the other end of the harm reduction service continuum is safe consumption sites. Currently, Indiana doesn't have one. Excuse me. There's very few authorized ones in the US, but they are slowly coming around. There's some places that are testing them. I know New York has one in a couple of harm reduction locations, and it's a place where someone can go use. And if there's a problem with the drugs, it's too strong for them or whatever, someone's there with Narcan easily for them. But there's also someone there that, like, if they need other services, like you're never going to have a safe consumption site without like SSP services. So all the other things that you could possibly need will be at the same site, and they can give you access to care. Let's see. So Indiana's Department of Health harm reduction program, this is what it looks like. We have non-syringe harm reduction partners. These are our counties that local health departments that we work with, public health officers, admins, health educators. It just depends on who the person is that's willing to take on the charge and start working, building that health education in their community. We currently have 14, 15 15 sites that are doing that. It's growing. We've grown a lot. The non-syringe harm reduction grantees, these are for us, it's a lot of different agencies. A lot of them were AIDS agencies that are HIV AIDS agencies that have over the years have like seen the shift of like where bloodborne infections are being transmitted, and now that it's injection drug use, they recognize that they're still needed, so they're um, working and partnering with us to get grant money to do more harm reduction programming in their counties that they work with. And they may work with more than one county, which is kind of awesome. And we have currently 6 of them. And they really cover the whole state. Just as might be, there might be a few patches of places that are not quite covered, but the they're there for that. There are 8 syringe service programs in the state. That means they've gone through the legal process to become an SSP in Indiana. Their health officer declared an emergency in HIV or Hep C, and they went before their either city council or their commissioners. Excuse me again. Talking too much makes me want to yawn. It but they've gone through the legal process to be an SSP, and they are allowed to exchange syringes. So they can give out new syringes and collect used ones. The other 2 partners over here can collect, but they cannot give out. And then we have our 4th part is the communities that are considering harm reduction program. So much like I'm doing today, I'm educating, I'm talking and sharing about our program specifically, but I'm also sharing about what it looks like to do harm reduction in your community, whether it's a city or rural. And we're always connecting with partners that way. We have the public health conference Wednesday and Thursday. We'll be at that, and we'll be talking to public health nurses there. And we're always looking to meet new people, and whether it's helping an agency work with their own community and their health department, or whether it's the health department directly, we're always trying to help expand harm reduction in Indiana. I'm going to share this video. This is something we had a partnership. We got grant money from the CDC, and we did a partnership with the Health Foundation of Greater Indianapolis and WFYI. They helped produce this. This one's talking about SSPs in Indiana. It's going to start out with Marion County and their Safe Syringe service program. So this is about 10 minutes. It's a really great video though. It's really going to show you what's going on here. Let me know if you can't hear it.
We're not able to hear anything.
Oh, that's what I was afraid of. Let's see. Let me see. Okay, well, that's all the way up. Shoot. It was pretty loud through my headphones. Can you still hear me talking?
Yes, we can hear you talking.
Okay. Well, I will tell you that we can share these slides. It may be just easier for you guys to watch it on your own. But there is a series of 6 or 7 slides. I forget how, or videos, I mean, not slides, that are available. And in this slides deck, you'll be able to connect after you because when it connects to the video, it connects to the others. But there is one about SSPs, one's about harm reduction, one's about peer recovery coaches. But it talks to the actual organizations that we've been working with. These were all filmed before COVID, and so we didn't actually get to do the rollout like we'd planned. We wanted to do this whole, touring the state and share them with everybody, because one of the things that they do, like this one's in Julie Foltz runs the program in Anderson, Indiana, Madison County, and so they work with a lot of rural area as well. So we wanted to make sure that we, people understood that this isn't just a city problem, this isn't just a rural problem, and how we were handling that in the different areas of the state. So we will bypass the video because I am not techie enough to figure out how to get sound to you guys. So sorry about that. So SSPs in Indiana, move this so I can see everything. Are all under, they're all authorized under certain circumstances under the state law. So there's two options, a way you can send this in or submit to get approval. Both of them, though, basically the health officer still has to make that declaration of an emergency. I'm not completely 100% sure what the threshold is, like if there's like just a slight increase or a percentage, but that's something we can help with. So like if a county's not sure if they have, a need to declare an emergency, that's something we can help you pull the data for the last couple of years and then your current year of what it looks like with HIV, Hep C, and see what that, your overdose looks like and so forth. But one of the requirements is if to have an SSP, you have to use our state or Department of Health SSP database. That provides data that we have to submit to the legislator. That's part of the law, the way the law was written. And when you get these slides, because we will send these out to everybody, there is a link that has like all the legal jargon in it. For those people that like to read all that. I will say that currently the way it's been approved in the state legislative office is that we can have syringe service programs and through July 1st of 2026. So we do have a few years before it would have to get renewed again. Our goal was the last time was hoping it was going to get matched with the ending the epidemics, that HIV, Hep C, ending the epidemics plan, which extends to 2030. But hopefully when we go to renew for 2026, they'll go ahead and extend it beyond that. Let's see. SSP providers in Indiana are providing non-syringe materials, ongoing technical support, and opportunities for funding from the Department of Health's harm reduction program. The use of federal and state funds to purchase syringes is entirely forbidden. So we don't give them funds to buy the syringes. They work with local partners or grantees like National Harm Reduction Coalition, the Health Foundation of Greater Indianapolis. To be honest, as a volunteer, you can donate syringes. You could donate them funds that would be discretionary funds. It's not tied to grants that they could easily use to buy syringes for their participants. SSP providers are required to use our database to do quarterly reports to the Department of Health, and then have a representation at our program statewide meetings. So as you can see, that's like 3 items. Now there's a lot of nuances in those items, but we want this to be as low barrier, low threshold as possible. We want it to be easy for programs, counties to be able to work with us, to be able to do syringe service programs, non-syringe service programs, whatever they're looking to do. We want it to be minimal barriers for them to be able to do that. And this is a little bit of a review, but the current 8 counties that are doing it are Allen, Clark, Fayette, Madison, Marion, Monroe, Tippecanoe, and Wayne. All of them are slightly different. Some of them have a partnership. Some of them are ran strictly by the health department. Some of them have a partnership with a qualified entity that may run it, or they might do it like both at the same time. They might be doing part of it out of the health department, part of it with their qualified entity. The programs so far have served over 20,000 Hoosiers, representing over 103,000 visits or opportunities to access care. So, I mean, that's pretty significant. And, and we don't, these are just the numbers that we've been collecting since we started the database. And original database was a spreadsheet when Scott County first got the SSP. And now we have a pretty fantastic database that works well, and we can actually pull the data out and, just click a couple of buttons and we get these numbers out much easier to share with everybody. Since December of 2019, we've given over 145,500 cases, doses of naloxone at our SSPs. Just our SSPs, those 8 counties have done 145,000 doses. That's pretty amazing. That's a lot of lives saved. The statewide return rate is 83%, meaning like if we've given out so many syringes and what's come back has been about 83, and that aligns with the national average. I think for most part, we usually hover like 1% or 2% above the national average. And the 3 most common referrals that we have from our SSPs are to treatment for substance use disorder, HIV testing, and then safer use and education. A lot of people, when you start using, you're taught how to use from either your own knowledge, or you found out how to use on your own, or someone showed you how to do something. Safer use education is always ever changing. We use the terms best practice because there's things that we learn all the time from people that use substances, like better ways to do certain things to cause less harm. And so we share that safer use education all the time with our participants. And this Erika had ran these numbers right before she updated these slides. So this represents from April 1st of 2015 all the way to June 1st. So how can you be a harm reductionist? Understanding substance use disorder is a disease and that it can impact anyone, that it's not a moral failing, that it's not something someone chose to do. It's just something that happened to them, that one day that drug that didn't bother them, however many times they took it, now if they stop taking it, it will cause them physical harm or withdrawal. That recognizes that it's a disease. It's not something that we're choosing to do this to ourselves. Learn and share the facts about harm reduction. SSPs and harm reduction, non-syringe harm reduction sites or agencies, any of the people that do this kind of work, that we're not engaging it to get people to start using drugs or to increase their use. We're trying to lessen the harm. So we have many, many stories that come from our SSPs where they've had people come in that were using 20, 30 times a day. It may be, could be back and forth between smoking and injecting, or, a one solid, but they were doing it multiple, 20 times a day, and now they're doing it 10 times a day. Maybe they're doing it 3 times a day. That's harm reduction. That's amazing that, the difference between a person that's using 20 times a day and a person that's using 10 times or 3 times a day is night and day. And what that does for them and their overall health is important. So, stopping the, when you hear something, say something, making sure that someone's not sharing their thoughts and opinions versus what's actual factual information. And we know that this does not enable people, that it increases their chances of getting treatment. SSP and harm reduction sites do help people living with active substance use, and it supports their overall health because they usually have better access to health. If you are a person that has substance use disorder and you go to your regular doctor may not treat you as well as a nurse practitioner or a harm reductionist person might if you came to a clinic that offers these services. Excuse me. They do offer a location to safely dispose of used sharps for the entire community, including those syringes for insulin, infertility treatment, hormones, whatever the reason is that someone's using a syringe, all those syringes can come back to a syringe service program and not be put in community trash. They can be disposed of in a proper, healthy, and manageable way to protect the entire community. You can volunteer or donate to harm reduction programs locally or, nationally. There's national organizations, but locally, I would encourage anybody to go like see what's in your own county. Most people don't know what even goes on at a health department in their county, and to find out that they have this kind of care or this kind of help for people, usually is a surprise to them. They're like, I didn't even know. I'm gonna tell more people, kind of thing. um, Help reduce the stigma around substance use disorder and promote the engagement of harm reduction practices. You will gladly will preach, as a society, we will preach about wearing our seatbelt and, having a designated driver and wearing your bike helmet and all these things because it's second nature, but it should be second nature for all things in life. If a person that's using drugs use less drugs tomorrow and keeps going less and less and less, they're reducing the harm in their person, and that's amazing. That's healthy. If I do one less Starbucks in a week instead of 5 in a week, I do 2, I'm lessening my harm. you know we want to make harm reduction discussions and conversations a part of our everyday life and make people aware and to help reduce that stigma about people who use drugs, because to be honest, looking to the person to your left or right, even though mine's a wall, you never know who the person is next to you or what their story is, and making sure that you're not adding to the stigmatized language that's out there may help that person next to you know that they can trust you and count on you when time is needed and they're ready for recovery. Oh, the fun part. We could do questions. And I think there might be one in there, but I'll let you guys tell me when you're ready, Carolyn. I'm gonna unshare so you guys can see me a little bit better. Do we have some questions? I think there's one.
We do have one. It says, where are these kits distributed? Just through the health departments in these counties?
So currently, the kids that I was showing for the example, we partner with our SSP, so they have them. So those 8 counties, we have local health departments that we work with, and we have agencies. So the agencies that we work with may work in a county that doesn't have an SSP or doesn't have the local non-syringe harm reduction program at their county level. They might be working in like a surrounding area. Um, and it's really just, that's just like street outreach. There's a lot of street outreach workers funded through different programs that have similar kits, but most of them you're going to find in those kind of that area. You can make those kits. Those items are easy to find and easy to get, but you could also go to a health department and say, I want some of those kits. I'm going to go, I'm going to be passing out blankets, and I want to take kits with me just in case. Um, but if your health department is not currently working with us and you want them to, talk to them about it, but then, talk to us, help connect us to people that, may need that program and they may not be aware that we can do it. One of the reasons we did this as a non-funded for health departments is because not everybody has the capacity to fill out a grant and manage a grant and take care of all that. But they just need to have the supplies. And instead of them trying to spend money or their own funds to buy these supplies, we give them to them at no cost. But then they just, they fill out the data, like where are they giving this out at? Who are they partnering with? They meet with us to talk about, how to expand education on stigma and harm reduction as well. So for the most part, it's like those specific kits are from our program and they go to the counties and the agencies that we work with, but that's always expanding. I literally just added a county yesterday. We've added like 8 this year, just since January. So it's been pretty amazing to see that our program build. Any other questions? I know I gave a lot of information and I talked a lot, so please ask questions, or, you'll get, we'll send these slides to Carolyn to get out to everybody. You'll have my email, you'll have Erika's email, but, there's no question that's too small or too big that I'm willing to answer.
And if you want to ask live, just raise your hand and I can open it up for you to ask the question live.
Oh, for sure, for sure. I will say that we didn't include it in the presentation, but I can let Erica know that we should send it in the when we send the slides to you. We'll include our map so you have a current idea of what the counties that we're working with. We have like it's color coded. The red ones are all the SSPs, the blue ones are all of the counties that are doing non-syringe harm reduction, and then we try and highlight the agency names and which counties are grantees that we work with. So it kind of gives you an idea. I don't want to say like I'll say an open spot, like where the open areas are that of places that may not have a service that's working directly with us. They may have recovery sites, they may have harm reduction coalition groups or other recovery groups that are doing great work, but they're just not currently partnering with us. And if they would like to, we would love to, work with more people. This has been like a passion project for us to be able to meet with you and present to you guys and have this information shared. So hopefully I did not do a bad job, and you guys will, go back through the slides and, pick up on all the little pieces I didn't read word for word and kind of think about this and what this impact could be for your communities.
All right. Well, thank you. It was very informative.
I appreciate it. We are happy to expand this for your specific county or for a specific region even. If someone wanted Erika or I to come in person and have a conversation with stakeholders in your area, like your community, whatever that may look like, we do that a lot. I was actually on 2 last week, attending in different parts of the state. Just talking about harm reduction and what it looks like in your area. So we're happy to do that if you would like a more hands-on approach.
Okay, well, I don't see any more questions. Again, this will be posted on our YouTube within a week. So if anybody wants to reach out to her, they can contact us and we can send you the information.
Sounds
If you don't have
wonderful.
any other questions, we can go ahead and close out for today. All right. Well, thank you.
All right. Thank you so much. It was lovely talking to all of you.
Thank you. Have a great
Thank
day.
you. Bye.